A lot of people live with back pain, hip pain, SI joint irritation, a posture that never feels quite balanced, and they never connect these issues to the possibility of a true anatomical short leg. This video explains exactly what that means and why it often goes completely unnoticed, even after years of treatment. You will see how a true difference in leg length creates predictable patterns of strain and breakdown throughout the body, and how a precise lift can correct those patterns when the proper height is identified. Most people have never been shown how to determine that height, which is why their symptoms continue despite doing all the right things. By the end of this video, you will see a real case from our office where the correct lift led to clear improvements in postural balance, along with significant relief of chronic symptoms that had persisted for over 30 years. If you have persistent pain that has never responded to treatment, this video will show you how an anatomical short leg may be the overlooked factor and what a correct solution looks like when applied properly. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years experience and a background in gait analysis, biomechanics, and neurology. My mission is to provide a thorough solution to spinal problems that develop from an unlevel foundation, like anatomical short legs, spinal and pelvic misalignments, poor posture, and foot dysfunction. This channel is for people dealing with chronic pain, like back pain, sciatica, neck pain, poor posture, or headaches, and are looking for real lasting relief. You'll get clear step-by-step strategies to address the root cause of these conditions and start feeling better fast. Subscribe now for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms, so you know exactly what to do. I upload a new video every week. A lot of people live with back pain, sciatica, hip discomfort, or an SI joint that keeps flaring up for no reason. These problems get labeled as muscle weakness, nerve issues, poor posture, or simple overuse. But what almost no one is told is that these symptoms often follow a very specific pattern that appears when one leg is structurally shorter than the other. Most people focus only on their painful area, which makes sense, but the body starts compensating for a foundation problem long before the pain shows up. When one leg is anatomically shorter, the pelvis tilts and rotates forward. The short leg spine shifts and twists to keep upright, and certain muscles tighten up to keep the eyes level with the horizon. These changes happen slowly, so you rarely feel them developing. What you feel instead is the strain placed on the tissues that are forced to absorb the extra workload. A shorter leg often leads to one hip hiking upward on the side of the long leg, and over time the SI joints being pulled into an unnatural position. With every step over time, those joints that were meant to move smoothly begin moving asymmetrically, and muscles designed for mild support activities end up having heavy-duty stabilizer activity and dramatically being overused. This is why the discomfort feels so persistent and often worse with increased activity levels, or when you try to do something that you don't normally engage in. And here's the key insight. The body never stops compensating on its own. These patterns run every hour of every day until the structural imbalance is corrected. Stretching therapy and exercises may help temporarily, but unfortunately, they're only temporary. Underlying forces never change, the symptoms keep returning. Once you understand this chain reaction, the path forward becomes clear. A mechanical problem in the foundation creates a mechanical strain pattern throughout, and it requires a mechanical correction to resolve it. When a true anatomical short leg goes unnoticed, the body's forced to compensate for years sometimes without relief. These compensations are subtle at first, but over time they place abnormal stress on the spine, pelvis, and supporting joints. As these forces accumulate, very predictable problems begin to develop. The uneven load on the lumbar spine accelerates disc degeneration and degenerative joint disease. The discs themselves are placed under asymmetrical pressure, increasing the likelihood of disc tears, disc bulges, and herniations. These changes do not happen all at once. They happen slowly as the body tries to adapt to an imbalance it cannot correct on its own. The pelvis shifts and rotates in the tilt position, which disrupts normal movement of the SI joints and forces one side of the lower back to work far harder than the other. This often leads to recurring back pain that seems to improve somewhat with treatment, but never seems to stay away. Nerve irritation is also common. As the spine compensates and the discs begin to deform, nerve roots can become compressed or inflamed, creating patterns that feel like sciatica. All of these issues share a common thread. They're not random. They are long-term consequences of an uncorrected foundation problem that the body's been fighting for years. Before any correction is made, we must first determine whether a true anatomical short leg exists and exactly how many millimeters of lift are needed to correct it. This is not a guess, it's a precise measurement process that uses specific tests to identify the exact height required. As discussed in prior videos, once we've taken a thorough history, performed a detailed postural assessment and physical exam, and in most cases performed standing pelvic and lumbar spine x-rays, a leg length determination can be obtained. All of these components have to be accounted for to determine the most appropriate amount to balance out the posture. Too great of amount, and you'll start a whole other host of issues. Too little, and the stress is reduced but not fully diminished. There are a few different devices we use to actually determine the amount of lift that's needed with a person. First of all, we use a plumb line or spinal analysis machine. What this has is a straight plumb line up and down that you can use to balance how much correction is needed by looking at pelvic levels, shoulder levels, and the overall plumb line dividing the body between two equal halves. The second thing we'll use is full-length lifts. These here happen to be 3 millimeters, 6 millimeters, and then we have a 12 millimeter one. You can actually stack these up, so if it's greater than 12 millimeters, you can stack 2 or 3 together to determine the amount. When we do the check, what we're looking for is a few things. So one, obviously you want to see what gets the pelvis level. But the second thing we're really looking for is what brings the head back to the midline. When you're assessing for a leg length correction, what you don't want to do is push the person beyond the midline. Like we spoke about videos before, there's a balancing center called a righting reflex. And when you start to go beyond that, now the body's gonna have to do other compensating mechanisms to correct for that. So when you start to push beyond the midline, the body's actually gonna fight against you to try and bend it back to keep the eyes level to horizon. So one thing you have to be very careful with is when you're doing these, is you want to bring the person definitely back to level, but not beyond that. So again, looking at all the different factors we talked about, degeneration levels with the health history and the exam, x-rays, postural assessment, you want to determine how much correction you can get away with, depending on how much degeneration maybe the person has or how old they are, how long the leg length difference has been there, and also the amount of leg length correction, without trying to push it too far. So it is a bit of a delicate balancing act, and obviously the more experience you have, the more you'll start to figure out how much you can push in certain cases. But these are the ways you actually will go ahead and do that. Once the correct lift height is measured accurately, a determination can be made about how it is implemented. A small enough correction of up to 5 millimeters can often be placed inside of most footwear. A correction amount of greater than 5 millimeters, though, has to often be put on the outside of footwear. Over time, this simple correction can reduce symptoms that have been present for years. In many cases, the effect is actually almost immediate. Back pain becomes less constant, hip and SI joint irritation calm down, muscle tension that's been present on one side of the body starts to ease, and episodes of sciatica can become less frequent or disappear altogether. By correcting the imbalance at the source, the body no longer has to fight the uneven forces creating the short leg, and relief often comes much faster than expected. The correction is simple, safe, and easy to tolerate. It also works well alongside other parts of the patient's treatment plan. Chiropractic adjustments tend to hold better, home exercises become much more effective, and the overall progress becomes easier to maintain because the foundation is finely balanced. To give you a clear picture of what the proper lift can accomplish, let's look at a real case from our office. This example shows exactly what happens when the correct height is identified and applied. This is the case of a client who's been in our office for about 20 years now. We started seeing him early in the 2000s. In his case, what he presented with initially was severe right lower back pain that radiated down into the right-hand leg. What happens in his case was he was getting a lot of pain in the lower back, into the right hip, down the right leg, extending even right down to the foot occasionally. And what tended to bring this on was more activity. So anything where he would do a long walk, or he'd be doing shoveling, or he'd be playing sports with his kids. In this instance, actually, the precipitating factor was he had been skating the previous week. He'd been out for a skate and probably about 20 minutes on the ice, and then literally had an exacerbation that lasted for about 2 weeks. So that's when he came to us to see us. So when we did our assessment with him, as you see the pictures, he presented with a severe translation. So in his case, when we looked at him, his spine was severely translating off to the left above the pelvis. So what was happening with him was he was leaning left severely and then trying to buckle back to right further up. So there was a few other things further up, but we'll just focus on the lower back for now. So in his case, again, he was presenting there, lots of inflammation, nerve root inflammation, muscle inflammation, primarily focused on the right side lower back. Now, the reason for this is even though he is leaning left and his short leg is on the left, so a lot of people will think, well, if you're leaning left and your short leg's on the left, the pain must be on the left. In his case, it was more on the right-hand side. And the reason this often happens, and it's almost always the case, is that when you are tilting to the left-hand side, if you're short on the left and your body's tilting that way, literally all the paraspinal muscles, so think of muscles in the spine like guide wires on a telephone pole, all those muscles along the spine have to be pulling tighter on the opposite side. So when you're translating or leaning to the left, the muscles along the right lower back have to be engaged more. And those muscles are meant to be engaged periodically and slightly when you're moving. They're not meant to be engaged and held at a steady state for a long period of time. They will fatigue. Just like if I gave a heavy grocery bag to somebody and said, here, carry this home, but just use your right arm. After about halfway home, they might start to feel a lot of pain in that muscle in the right arm because they're just using one muscle, a static contraction. So this will happen oftentimes in the low back. And then, like I said, with extra activity, all of a sudden you push it a little bit beyond what you would normally push it, and it'll flare right up. And we said become much more inflamed due to the muscle, the joints, the nerve roots around that area. So in his instance, what we started with after we did the initial examination is we started him with a course of adjustments. We'd done x-rays on the spine. Back then, we don't have those anymore, unfortunately. But we will show those in a later video, a follow-up with that. But we did x-rays in the spine time. There's very minimal degeneration, fortunately for him. So we actually started with a course of spinal adjustments to get the actual spine moving better. And then what we've done is we added a 12 millimeter lift on the left-hand side for him. So obviously 12 millimeters is, half of an inch, or, it's a pretty thick lift we added. So again, we'll show in the picture how we added that. And what we do with lifts in our office is we always do full length lifts, meaning that it runs the full length of the footwear. Now, 12 millimeters couldn't be fit inside the footwear, so everything in his case has to be added onto the outside of the footwear, as we show in the picture. And it runs from heel out to the front of the foot to the metatarsal heads at 12 millimeters, and then it will slightly taper up from there just so it's smooth with walking. But what that does is it brings that whole side of the body up to level. Okay, so it brings it to a point where now your whole pelvis can sit on a level foundation. So picture standing with one foot on a road and the other foot up on a curb. Okay, so you have this tilt. What that lift does is it evens those out. Okay, obviously a road and a curb would be pretty high, but imagine if there's a 12 millimeter difference, what it does, it brings that whole lift up, or that whole leg up. The reason we do this across the whole foot is if you were just to put a heel lift in, you would lift that heel, but you would start to introduce rotation. So you start to be tipping that forward. It's like wearing a high heel on one side, not the other. It actually changes the mechanics in a different way. So although it may help slightly or temporarily, it doesn't usually fully fix the problem and sometimes introduces new issues. So what we always do is a full length lift to the height that we need, and we draw that whole foot up. So like I said, in his case, because it was 12 millimeters, we had to go with a built-on lift for his footwear. So we have a place in town here that does that. A lot of shoe places will, relatively inexpensive to be able to do that with footwear. And it brought him up and leveled him right out. The great thing in this case is that once we did some adjusting, once we got the spine moving better, once we got the lift in place, completely changes his life. Now he could go out and perform activities that pretty much anyone in their, 40s to 50s could do. He had this for his whole life. But now he was able to actually, play with the kids, play tennis, do some skating, all these things that as long as he had the lift in place and was consistent with that, his muscles, his spine could completely adapt to the change that he had. So this is how we correct for, in this case, a 12 millimeter short leg on the left. I hope this video gave you a clear understanding of how important a properly measured foot lift is when addressing an anatomical short leg. If you've been told that you have a short leg, the next step is determining whether a foot lift is appropriate for you. Look for a doctor who's trained and experienced in evaluating anatomical short legs and providing correctly measured lifts. You want someone who's qualified and understands the details that make this correction effective. If you have any questions, drop them in the comments below. If you found value in this video, like and share it so others dealing with the same issues can finally get answers that make sense. And remember to subscribe if you want real solutions for pain relief, better posture, and a clear understanding of what is causing your symptoms so you know exactly what to do next. The next video you should watch is this one,
If you have low back pain or short leg, go watch that video next.